A lot of people want a blood test. They think it's going to solve all their problems. First question you need to ask yourself is, what do I need to do a blood test for? What am I hoping it's going to be able to tell me? What information do I need? And even if it's going to give you information, does it change anything that you can't start to address right here, right now? Because even if you are given some type of answer, your symptoms to me speak louder than anything. So symptoms are always, for me, the first place that you start. Say you've got a bunch of symptoms, you've been trying to unpack them, you've assessed everything, and you kind of know what you're dealing with. The next step can be a blood test or a saliva test or a dry urine test. We've talked about all of these so many times before in various ways. We're just going to talk about testing in general. The other thing I think is really important for us as women is tracking every single day. Every single day is another notch in your belt, another rung in the ladder. Having testing every few years can be amazing. When I was in my 30s, even in my 20s, definitely, having a blood test, it was literally the last thing that I wanted to do. So much so that I never had any. I don't have any data from when I was in my 20s at all. I never had a blood test. My first blood test was when I was pregnant with Olivia. It didn't really tell me that much about my body because my pregnant body is very different from my regular body. It obviously helped at that point in time to understand my body and my pregnancy and everything that was happening. But beyond that, it's kind of useless now. Why am I telling you this? Because I think it's important to have consistent information that we can look back on and we can see what our hormones have been doing at any given time. It's also great information to hand on to your children, especially your daughters. I'm upset that I didn't really have any information until my late 30s. And of course, by the time I was in my late 30s, my hormones have changed. They're different to what they were in my 20s. Being able to just have the information, it's not for any other reason, just to have it, to compare to test results in the future, I think is another really smart reason why you might decide to go and have a blood test. Now, the issue with that is you're going to go to your doctor and you're going to say, hey, my friend, I'd like my blood tested for my hormones. You're either going to be met with one of two things. Your GP, because that's who you're going to often to get blood tests. Often it's not their arena. If you came to me and you asked me for some testing that wasn't my area of expertise, I would have a hard time interpreting that and then using that information. I might say to you, I can test all these things and I can give you the results, but it's not my wheelhouse. Fine. But that's often not what happens when you go to your GP. And that's also because your GP wants to help you and wants to give you answers, but it needs to be within their lane or scope. Your GP might say to you, there's no use testing hormones. They're different every day. Thank you. We know that. That's why we want to test them on certain days. So the first thing there, I would say, is there are specific days that you do want to do your testing on depending on what you're doing in certain circumstances. It may not be like I said, their area of expertise. They may not know exactly what to ask for. So often you think you're getting an amazing blood panel and you're just getting a standard test. I can't tell you how many times this happens, and someone will come back with no hormones tested, no thyroid test. I'm like, great, we know where your iron and your vitamin D is at. Doesn't give us a great picture when it comes to the inner workings of your body as a woman. The other challenge that you might have, your doctor might put through the request, but it's actually the pathology lab that decides how much of that is being tested. So for example, you're wanting a full thyroid panel, your doctor requests a full thyroid panel, and then that gets sent to the pathology lab. The pathology lab then decide the first thing we test is TSH, thyroid stimulating hormone, and it looks fine. So we decide at that point there's no further testing needed because your TSH is fine. The problem with this is, and especially when we look towards functional medicine, is TSH isn't even actually a thyroid hormone. TSH is how much your pituitary has to signal the thyroid to work properly. So you're not even actually testing thyroid until you actually get into T3, T4, reverse T3, antibodies and the rest of it. These can be a big reason why you're told your test results are fine when you don't feel fine, because we haven't got the full picture. Also to that point, sometimes it's who's interpreting the test results. Before I get ahead of myself here, let's just come back to the pathology lab. So the pathology lab decide at what point the testing runs to, which means you may not get a full panel. It's so that people don't go back and abuse the system. The other thing that's very interesting when it comes to our pathology testing, the pathology lab decides the reference ranges. If you really think about it, okay, the majority of people being tested are either unwell or there's a reason that you're seeking testing. You're not just doing it out of curiosity. The cross-section of people, their blood work is being examined, there's a good chance that they're not very well trial in the first place. So the reference ranges can be questionable. And this is why when we look at conventional reference ranges and compare them to functional reference ranges, they're very different. Let's use thyroid again as the example. Now, to my best understanding, thyroid ranges were updated in 2003. Not all pathology labs have updated it and not all doctors know this. What it means is when you go and you get your TSH tested and you're told you feel fine, but you don't feel fine, here is why. So the reference ranges were updated to be something around 0.5 to 4. The old reference ranges, the conventional reference ranges from pre-2003, were between 0.5 to 5. That's a big range, right? 0.5 to 5, updated to be 0.5 to 4, but functionally 0.5 to 3. So if your TSH comes back and it's above 3, that's a huge warning sign to me. But if the pathology lab hasn't updated, you're going to be told that you're fine when in actual fact you're off the charts. So this is just one example of many where we've got outdated reference ranges. Your doctor gets the report back and your doctor is reading a report to you based on what the pathology lab has concluded, not necessarily interpreting test results. If someone has actual understanding in how to interpret a blood test, they're going to be able to look at these numbers regardless of what the report says and look at the other hormones involved and be able to give you a clearer answer and a clearer picture, because hormones just don't operate as a silo. And we're not all separate. They're all working together. It's like a symphony orchestra. And when it's working, it sounds fantastic. And when it's not, it sounds like absolute rubbish. And that's why you feel like rubbish. So you can start to see how many small issues there are when it comes to, firstly, getting the testing that you want. And secondly, the information that is gained and then relayed back to you. There's a lot of problems here already. Your doctor's probably asking for the right testing, but the kink there is the pathology lab. Then there's the reporting, but then there's the fact that your GP, if it's not their lane of work, they don't specialize in hormones, then they're going to be reading that report more than likely. They're not actually getting in there and interpreting it. This is why I really love for patients to invest in testing at an independent lab, which means it is out of pocket, but guys, you get what you pay for. In those tests that you request, you are going to get everything that you ask for because you're paying for it. I know some of you are sitting here going, well, that sucks. That's not fair. I get it, but it's the world that we live in. And then the next step is having the right pair of eyes on it that can look over it and can understand the different ranges and look at what that means in proportion to other hormones.